Welcome back. I'm Brent Meredith, and if you're just joining us, I'm talking with Selena Haynes, Connect Media Group co-founder, and Ray Zimmerman, Director of the Office of Diversity Affairs and LGBTQ Health at Vanderbilt University Medical Center, about their upcoming LGBTQ Community Health Fair on Saturday, April 30th. So I just teased the date there, you guys. I know we're going to talk about that a little bit more in depth later, and we'll have more time for details. But now that we've sort of talked a little bit why we're invested in this, I'm a little curious to understand, you had mentioned the survey, Selena, at the beginning. I remember taking the survey. I was curious if you would talk a little bit more about that. We know the health fair was top of the list. What else came out of that, out of that survey?
Well, sure. So we had about 22 options for people to choose from. We wanted to see what they wanted to have outside of Pride festivals. One of the top ones was the health fair. And we also had an LGBTQ plus marketplace and art and cultural events. So we do have some other events planned in the near future that will go along with what people have been asking for. And, go ahead, I'm sorry.
I didn't mean to interrupt. I'm sorry. No, you're fine.
No, I was going to go a little bit more about the actual survey on health fairs.
Yeah.
One of the statistics through Community Marketing Insights is actually on LGBTQ friendly health coverage. And over almost nearly 50% of people say that when deciding on your primary healthcare provider and health plan, did you seek out a doctor or plan known to be LGBTQ friendly or known to provide quality care to LGBTQ people? So nearly 47% said yes. So that tells you right there also that this is what people are wanting and needing in the community. And this is one of the main reasons why we are having the health fair.
No, and that's a really good point. I've had many friends that have moved here, since I've been here since the late 90s, and I've been fortunate to have a gay doctor this whole time, and I've referred him, and people have asked, and they want to. It's not so much that they don't trust a non-LGBTQ doctor. There's just some things that you don't have to explain. There's some things that are just inherently understood, and if you can't be comfortable with your doctor, then who can you be comfortable with, right? So it totally makes sense that people would be really concerned about feeling comfortable at the doctor to be able to talk about whatever health issues they might have. And Ray, if I could switch to you for a minute, I was encouraged, back when Vandy announced their trans health care, one of the first here in the area. I thought you might want to speak to that a little bit as well.
Absolutely. We've been seeing trans patients for quite a while, but in 2018, we opened up a new model for care. Actually, out in the Bellevue area, we started an adult clinic. And actually started on a small scale, but for the first time, patients were actually able to self-schedule, and we went to an informed consent model. Historically, there have been such barriers for trans people to be able to access hormone therapy. We took those barriers out. And so after meeting with a doctor, understanding that informed consent, trans patients can actually get access to hormone therapy pretty quickly. We started with one lone provider. We now actually have 4 different providers offering hormone therapy. In 2019, we actually added a full scope of gender-affirming surgeries. Again, we had been doing top surgery for a while, but 2 of our own surgeons stood up and said, hey, we really want to provide a full scope of gender-affirming surgery here at Vanderbilt. And so our plastics chair sent them around the world for training. They came back in 2019, established a full-scale program, and now we're seeing patients from around the region who are undergoing phalloplasty, vaginoplasty, metoidoplasty, facial feminization, and again, top surgery as well. So we are looking to add even more services in the years to come, and really based on the success of our gender affirming services program, I think over the next couple of years, you'll be seeing more from us as we continue to elevate and push the envelope on the clinical services that we have.
Well, and I'm so glad to hear all of that, and especially the addition of pushing the envelope, as you say. If I can ask this, and you can answer it in a way that you're comfortable with, but given the state that we're in and what we've seen very recently in the legislature and what's been even going on nationally, how important is it for maybe your current patients or potential patients to see that you're there? What might you say to comfort them in these times we're in, if I can ask it that way?
Well, I'm glad you asked. We certainly want LGBTQ patients to know that Vanderbilt is there for them. And again, we provide those navigation services to connect people to resources, whether it's at Vanderbilt or not. And that's really, really important. There is a historic distrust among LGBTQ people as they intersect with medicine. And we know for sure that LGBTQ patients are more likely to delay care because of past instances of bias and discrimination. And and so we just want to continue to put our stake in the ground to let our community know that Vanderbilt is here for them. We want to be a provider of choice for the LGBTQ community. And in relation to the bills that you mentioned, some of those have direct intersection to healthcare. And over the years to come, we're an academic institution, and we want to significantly increase our research profile so that we are collecting new data that will speak to those bills and teach our legislators about the unique needs of LGBTQ patients and why it is important not to enact structural barriers that would prevent getting people life-saving care.
No, that is, thank you. Wonderful answer. I appreciate you commenting on that. I was hesitant to kind of put you on the spot there, but I did want an honest answer on how that's being perceived within the organization. So Selena, we've let Vandy do some talking, or Del Ray give us the scoop on VUMC's involvement, but what are some of the other sponsors? I know Metacopy is your presenting sponsor. I thought you might want to give them a shout out, and anyone else that's participating on a sponsor level.
No, absolutely, and thank you. And we do thank Metacopy for being our presenting sponsor this year. And for those who don't know, Metacopy offers more of like business-to-business services, but they take care of your medical records and make sure that they're secure and that they're being transferred securely as well. And so we just thank them so much for supporting us. We have our champion sponsors also include Music City Prep and Cheekwood. I love it that Cheekwood is participating. It's one of my things was, what is better for your health than being outside, getting mental health and physical health all in one at Cheekwood. And they're actually going to be offering a couple of memberships that they'll be giving away. So make sure you come in and visit them. And so Cheekwood, and then let's see, we have, of course, Vanderbilt, and then we also have Mashup Nashville. And if you haven't heard of them before, they're an organization that is also concentrating on health for minorities. One thing that they have right now, I believe, is a grant that is available to help them with smoking cessation programs. Oh. So they'll be there talking about smoking cessation. So that's pretty much our main sponsors, and we do have some other sponsors as well. So
cool. Well, I want to circle back, and I have a follow-up to that, but we do need to take a short break. So we'll be right back with more on the LGBTQ+ Connect Community Health Fair right after this short break. Stay with us.